Starting with the name of Allah, the most gracious and the most merciful. My name is Dr. Bilal, and today we are going to discuss the General Toxicology portion 3. In the first portion, we discussed about what is general toxicology, how can one classify toxicology, and the general definition of the dose, poison, lethal dose, LD50, ED50, and safety index. That was in the first portion. In the second portion, we discussed about what is different route of administration of poison, what are the different route of elimination of poison, what is the fate of the poison, and at the end we discuss medical legal aspect of the poisons. Now in the third portion, our learning objectives will be how can one diagnose the poison in the living, in the living, in the dead, and what are the general principle of treatment of acute poisoning. Person who has been poisoned acutely, what is the general management for that? The general managements are these points. These points are extremely important in exam, or I should say they must be appeared in the OSPI. So the removal of the unabsorbed poison from the body, this is the first target. That all of the unabsorbed poison that are present inside the body must be removed. After that, we will use the antidote, and then after using the antidote, we will go for those poison that are absorbed inside the body. We need to eliminate that. Of course, the poison will go inside the GI tract, and there they might be remain unabsorbed, so we need to remove that. And then those which are absorbed inside the body, we need to remove that as well. Then we go for the general sign and symptom treatment and maintenance of the patient condition. These are the points extremely important. One should know about that. Must appear in the exams. These 5 points are very, very valuable. So the removal of the unabsorbed poisons, use of the antidote, removal of the absorbed poison, and eventually general sign symptoms and patient general condition treatments. So these points must be known. These are the general principle of treatment of acute poisoning. Let's start it. How can one diagnose the poison in living? So if a person is living, he must go to the casualty department. He must or she must show some sign and symptoms so we can find out the poison in the casualty department, and in the dead by through the autopsy or mortuary. So how can one make the diagnosis of the poison in the living? For example, let's suppose we take a case that a person who has came to the hospital with some sign and symptoms which are accompanying the poison. So the history is very, very, very valuable. The best doctor is the one, the best physician is the one who take the best history, and it completed almost 80% of the diagnosis. So we will ask about the person himself or the relatives or the friend colleagues who are accompanying the intoxicated person. The history will specify us that there's something wrong and he might have taken some poison. Second is the sign and symptoms. For example, he might have taken some narcotics and the sign and symptoms are showing a sleeping tendency. So as a doctor, as a physician, it must come through your DDs that he might have taken some such type of poisons which are acting on the nervous system and having the sleeping tendency. That might be appear he is overstimulated and showing some very high convulsions like opisthotonus, pleuristotonus, or other high convulsions. So we might go for stimulants that are like Nox vomica or strychnine that are acting on the spinal cord, and these are causing these convulsions. So the topic of this discussion is like the sign and symptoms are giving us a glimpse of idea about the poisons that has been used. In nitric acid, the color of the vomiting will be yellow, a very, very high yield sign for the nitric acid poisoning. Now the third step is the examination. There are two type of examination: general physical examination and systemic examination. General physical examination start like the simple mnemonic for that is JACLET. GACLET. So generally, after checking the JACLET, if the joint is present or not, anemia, chylinokia, cyanosis, or any lymph enlargement, any temperature enlargement, all of these are checking in the General physical examination. Systemic examination, we go for the GI, for the respiratory, for the central nervous system, abdominal examination, all of these. So examination also gave us a very good idea about the diagnosis of poison in living. The top most important is the laboratory diagnosis. If I take some blood or serum or some viscera and I take that for the examination to the lab will specifically tell me about the poison that has been used. And the miscellaneous are maybe extra required, maybe some biopsies, maybe the ultrasound. For example, in the hepatomegaly, when the person is taking the alcohol for a long time, initially might go hepatomegaly and eventually it goes to the cirrhosis. There's a specific type of cirrhosis inside the liver. We call that alcoholic cirrhosis, highly in combination with the alcoholic toxicity. As well as we can go for the if we are using the cardiac poisons like oleander or nicotine and tobacco, so we will go for the ECG as well. They are coming in the diagnosis of the poison in the living under miscellaneous categories. Now, how can one diagnose the poison in the dead? Of course, it will not come to the casualty. First of all, the history. In that case, the history would be the FIR. The FIR or the police study report that how the person has been dead or how this condition has been occurred. So the police will tell you that to perform the autopsy or examination of that person, that will specifically having the histories or the study papers must be there, and each of them must be signed and written and seen along with the also write the date. Now, sign and symptoms might be observed by the CMO, which is present in the casualty at that time, if it appear in the hospital or during the treatment in the treatment charts. So we can go for the sign and symptoms that are appeared inside at that time before the death. Now, in the third, we'll go for the postmortem examination. The most important autopsy. I will be discussing the autopsy itself with you guys in a different topic. That what is autopsy? What are different type of autopsy? So autopsy is actually the external examination of the body, external and internal examination of the body for finding out the cause of death. So if we are going for the external examination, clothes having any stains are very valuable evidence. Other than this, without the cloth, we will remove one by one and step. If the person is going through the postmortem rigor mortis, postmortem rigor mortis is a condition where there is a very high stiffness and this is very difficult to remove the clothes. So you will cut that along with the line of stitchings. For example, this is a dress. These are the sleeves, and you need to cut the sleeves by the portion of the stitching and then here and then stepwise wherever the stitchings you will to remove that and then remove the dress for the examination. Then we'll check for the whole body external or offenses might be having some bloody shades, might be having some uh, secretions, which will give us a good idea about the examination. Now we'll go for internal examination. There are different procedures for the internal examination. We'll be discussing them in a separate chapter of the autopsy. Right now, the simple thing is in the dead, we will go for the checking of all the three cavities one by one after the death. So that will give us an idea. Chemical analysis, there are different poisons who retard the process of the putrefaction. For example, this arsenic, organophosphorus poisons, all of them, datura, carbon monoxide, if they retard the putrefaction process, so it help us to remain the evidence remains safe. So if the evidences are safe, that will help us in diagnosis of the poisoning in the dead as well. Hence, they can be detected after a long time of the death even after the exhumation. So that's all our topic. We discussed how can one know about the diagnose the poison in the dead and in the living. These topics are important. Now there are separate subtopics for the living and separate subtopic for the dead. Now, what are the general treatment of acute poisoning? So this is a very important topic. We talked about that. General treatment of the acute poisoning is first of all, we need to remove the unabsorbed poison. I discussed that in the introduction as well. Unabsorbed poisons are those poisons which are inside the body but not absorbed yet. I must remove that from the body by different procedures. Then I'm going to go to use for the antidotes. Every poison have specific antidotes. After that, I will go for the elimination of those poison which are observed inside the blood, which are observed and showing their systemic sign and symptoms So I have to do some procedures to eliminate that observed poisons, and after that I'll go for general sign and symptoms treatment. These points are extremely important in the exams as well. So how I'm going to remove the unobserved poisons? So removing of the unobserved poisons, first of all, if that is inhaled, so what will be my target goal? My target goal is to remove the person to the fresh air, because if you are starting resuscitation him in the specific area where that has poison is present in quite amount, it is dangerous for the doctor as well as for the patient. So first of all, if the poison is an inhaled poison, so first remove from to the fresh air, and after that the artificial respiration is extremely important in the inhaled poisons. If the poison is injected like in the snake bite or insect bite, so we need to apply the tourniquet at the site of bite. It will stop the circulation of the blood. If the wash of the wound is also important with the potassium permanganate. If that not available, we can use any antiseptic for the removal of the injected poison. Now the third one is the contact poison. If the poison has been spilled or sprayed on the eyes, on wounds, so the washing is the first category. Wash it with the plain water or with the normal saline. So these are the different things by which we can know about. If that's inhaled, remove in the fresh air and give oxygen. If that's injected, apply tourniquet. And if that is in contact, then wash it. Now, if that's ingested, we can remove it by two different processes. First of all, the vomiting. Induce the vomiting and all the unabsorbed poison will come out from the body. If we cannot induce it, the second step is the gastric lavage. It's very important. Both of these steps are must be initiated in the first hour of the introduction of the poisons. After that, the poison will start observing. So this is very, very important to produce these steps in the very, very initial step. How can one produce the vomiting? By giving the emetics. Emetics are the drugs that will produce the poisons. The most important emetics is apomorphine. Apomorphine is subcutaneously given, and that induce a high amount of vomiting. And we already gonna discuss the gastric lavage in a separate chapter. What is gastric lavage? What are the indications? What are the contraindications? Now, vomiting. If the person is conscious and cooperated, just touch the soft palate, then that will induce the vomiting by itself. Or you can use the emetics. The top example for the emetics is apomorphine 4 milligrams subcutaneous. Most of the time appear in the MCQs that the route of the administration of emetic apomorphine 6 milligram is IV, IM subcutaneous. One must know that it is subcutaneous. If it's not present, then you can go for the concentrated solution of the common salt and water. It will also induce the vomiting. Vomiting is contraindicated in the corrosive poisons. For example, the poison is a very highly corrosive as sulfuric acid or acid, so you cannot produce the vomiting. It further decreases the problem. Strychnine is a very, very different type of poisons in which there is a highly conversion, and a simple stimulus can produce the conversion again. So you cannot perform in strychnine and nox vomica. Similarly, like the petroleum distills, you cannot perform that, and it's absolutely contraindicated in the coma, severe cardiac and respiratory diseases, and in the advanced pregnancies because it might produce the fatal results. Now, how can one treat the poisons? Let's revise this. Remove the person from the source on top. Remove the unabsorbed poisons. How can one remove the unabsorbed poisons? By producing the vomiting and by the gastric lavage. Now, how gonna we remove the absorbed poisons? We're gonna discuss that. After the absorbed poisons, we will go for the antidotes. After the antidotes, the next step is we are going for the. It might be the chemical antidote, it might be the universal or specific antidotes that are used. Now we are specifically discussing the absorbed poisons. Those poisons, they are present inside the body and they are acting right now. How I'm going to remove that? I'm going to remove that by forced diuresis. What is forced diuresis? It's a procedure where which I will make the urine so much alkaline that they will emit out of the body. So most of the time for the aspirin, for the barbiturates and alcohol, we are using the same procedure. After the forced diuresis, we can go for the peritoneal dialysis, or we can go for the artificial kidney or hemodialysis to remove all the poisons. that are absorbed inside the body. How can one go for the symptomatic treatment? That is, ensure the IV line is secure with us. We can inject any type of drug anytime. Ensure that he is treated with analgesic and all the pains. Ensure that he is having oxygen inhalation. And if there are convulsions and CNS is highly exaggerated, so we'll go for the CNS depressants. And if there is a sleepy effect, so we can go for the stimulants like tea and coffee. All the symptomatic treatment must be done. How can one maintain the general treatment of the patient? So we will clear the airway if there are any saliva or froth are producing. So it must be cleared by the suction machine. And next we will go for the normal electrolyte balance. It's very important for reducing the normal function. Good nutrition is very important for the recovery, as well as psychophysiotherapy is important in the case of suicide. Why the person has performed the suicide and might perform that next time. So we will go for the psychotherapy or physiotherapy and all of these things to make him calm down and find the real cause for that. Yes, the physiotherapy might be needed if the injury is very, very much severe. And that all of these discussions, we didn't discuss the antidote. So we'll be separately discussing the antidotes in the next portion of the general toxicology. So this is very important. Let me revise this again. How can one treat the poison? We can treat that by removing the source, by removing the unabsorbed poison through the gastric lavage, by inducing the vomiting, or the third step is remove the absorbed poisons. These are must be performed by the peritoneal dialysis, by the hemodialysis, and then we will use the antidotes. Antidotes will be the next topic, specifically different type of antidotes and how they are using, what are their actions, and what are their examples. Very important exam questions. We'll be discussing that in next portion. If there are any questions, please do ask me. Thank you so much.